Medicare Open Enrollment is here, and it's your chance to review and make any necessary changes to your Medicare coverage. Whether you're thinking about switching from original Medicare to Medicare Advantage, changing your prescription drug plan, or simply making sure your current coverage still fits your needs, now is the time to do so. From October 15th to December 7th, you can make decisions that will impact your healthcare for the upcoming year. In this video, you'll find answers to some of the most common questions about Medicare Open Enrollment to help you maximize your coverage and reduce your costs for 2025. What changes can I make during Medicare Open Enrollment? During Medicare Open Enrollment, you can make a variety of changes to your healthcare coverage. If you're currently enrolled in Original Medicare, you can decide to switch to a Medicare Advantage plan, also known as Part C, which often includes additional benefits like dental, vision, and hearing coverage. On the other hand, if you're in a Medicare Advantage plan and feel it no longer suits your needs, you can return to Original Medicare. You can also join, drop, or switch to another Medicare Part D prescription drug plan if you're in Original Medicare. If your medications have changed over the past year or your current plan has updated its formulary, Medicare Open Enrollment is your chance to find a plan that better fits your prescription needs. Taking the time now to consider your options ensures you have the right plan for your medications, minimizing any surprises when it comes to out-of-pocket costs. Why should I review my Medicare coverage every year? Reviewing your Medicare coverage every year during Medicare Open Enrollment is essential, even if you're satisfied with your current plan. Your health needs may have changed over the past year, and what worked well for you before might not be the best option anymore. Medicare plans can also change their premiums, deductibles, and coverage, which could affect how much you pay for your health care. Another reason to review your Medicare coverage is the upcoming changes to Medicare Part D in 2025. Thanks to the Inflation Reduction Act, your Part D plan will soon undergo significant changes. These upcoming changes will simplify your coverage, expand your benefits, and lower your prescription drug costs. If you rely on prescription medications, it's a good idea to evaluate how these new policies will affect you. Lastly, it's important to verify that your preferred doctors, specialists, and pharmacies are still included in your plan's network. Some plans may change their networks or service areas, which could lead to higher costs if your providers are no longer covered. What's new for Medicare in 2025? As you review your Medicare coverage during this year's open enrollment, it's important to keep in mind the significant changes coming to Medicare in 2025. One of the biggest updates is the introduction of a $2,000 out-of-pocket spending cap for prescription drugs under Medicare Part D. This new cap will limit the amount you'll have to spend on your medications each year, providing more financial security and making your healthcare costs more predictable. In addition to the spending cap, Medicare Part D is also eliminating the coverage gap, often referred to as the donut hole. Starting in 2025, this confusing gap will be removed, meaning you'll have a smoother transition between different coverage phases. On top of these improvements, the introduction of a new manufacturer discount program will give you a 10% discount on brand name drugs during the initial coverage phase, rather than waiting until you hit the coverage gap. How do I know if a Medicare Advantage plan is right for me? Choosing between Original Medicare and a Medicare Advantage plan depends on your healthcare needs and personal preferences. Medicare Advantage plans can be a great option if you're looking for additional benefits beyond what Original Medicare offers. Many of these plans include coverage for services like dental, vision, and hearing, which Original Medicare doesn't cover. Some plans even provide benefits such as fitness memberships and transportation to medical appointments. However, it's important to consider how Medicare Advantage plans manage your care. Unlike Original Medicare, which allows you to see any doctor who accepts Medicare, Medicare Advantage plans have their own network of healthcare providers. You should also think about how you want to handle prescription drug coverage. Most Medicare Advantage plans include Part D prescription drug coverage, so you won't need to sign up for a separate plan. How will my choices affect my coverage for 2025? Any changes you make during Medicare Open Enrollment will take effect on January 1st of the following year. This means that the decisions you make now will determine your healthcare coverage for the entire next year, so it's important to consider how these changes will impact you moving forward. Once your new coverage begins on January 1st, it's essential to review any documents you receive from your new plan. This includes your identification card, formulary, and explanation of benefits. Make sure you understand how to access care and fill prescriptions under your new plan, so you're ready when the new year starts. Remember, Medicare plans can change from one year to the next, and so can your healthcare needs. Whether you're looking to save money, get better coverage, or simply ensure that your current plan remains the best choice for you, Medicare Open Enrollment is your chance to make adjustments that ensure you're getting the most out of your coverage. Whatever you do, don't wait until the last minute to decide. Your health is your most valuable asset. Take the time now to explore your options. If you're unsure which plan is best for you, or if you have any questions about how the upcoming changes in Medicare might impact your coverage, a licensed agent can provide the one-on-one assistance you're looking for. For more information about Medicare, please speak with a Senior Healthcare Solutions Medicare expert today at 866-633-4427. Thanks for watching. Like and subscribe for more Medicare videos.